Could you imagine living a life where you constantly had so much anxiety and worry that you had difficulty even getting through your day? Think of the thing that you fear the most and how it makes you feel. Now imagine that thing is no longer there, but the fear that it once gave you still is, so much that it's overtaking your mind. That's what it's like for people suffering from generalized anxiety disorder. My name is Amy, and today I will be discussing with you generalized anxiety disorder, also known and abbreviated as GAD. According to the Anxiety and Depression Association of America, GAD is characterized by exaggerated excessive anxiety and worry over everyday life events, with no obvious reasons. According to WebMD, 6.8 million adults are affected by GAD in any given year, where women are twice as likely to be affected. Let's learn more about GAD by discussing symptoms, causes, diagnosis, and treatment of this disease. Symptoms of GAD are not only limited to mental, but can also be physical. Some of the mental symptoms of GAD include excessive, ongoing worry, unrealistic view of life problems, excessive worry, feeling restless, irritable, difficulty concentrating, trouble falling asleep, and being easily startled. Some physical symptoms include muscle tension, headache, sweating, nausea, fatigue, and trembling. Now that we've gone over some symptoms, let's talk about the causes of GAD. Although the exact cause is unknown, there are several factors that are linked to the development of GAD. These include genetics, brain chemistry, and environmental issues. Some research shows that GAD can be passed on through family members by genetics. Another cause linked to GAD is abnormal cell pathways in the brain associated with emotions and thinking. If the pathways do not work efficiently, problems with mood and anxiety may result. Abuse, the death of a loved one, changing jobs or schools may also contribute to GAD. The use of drugs and alcohol can also contribute and worsen this disorder. So far we have discussed symptoms and causes of GAD. Next, we will talk about the diagnosis process. If symptoms of GAD are present, a doctor can perform an evaluation by asking questions about family history, medical history, and conducting a physical exam. There are no lab tests to diagnose GAD, but a doctor can base their diagnosis on reports and duration of symptoms. If symptoms have persisted for 6 or more months or interfere with a person's ability to live a normal daily life, a doctor can determine the degree of the disorder. After a diagnosis has been made, a person may begin treatment. A person may be referred to a psychiatrist or a psychologist, doctors who are specialized in professionals trained to treat illnesses such as GAD. Drugs may also be prescribed for people who have severe degrees of this disorder. These medications usually come from the class of drugs called benzodiazepines. These drugs are also considered to be called minor tranquilizers because they eliminate the intense feeling of anxiety. Common types of these medications are Xanax, Librium, Valium, and Ativan. Certain antidepressants such as Paxil, Effexor, Prozac, Lexapro, Zoloft, and Cymbalta are also used to treat GAD for longer periods of time. GAD is a very serious illness that affects so many people in their everyday lives. With present symptoms and a medical diagnosis, a person can be treated for this disease. If you or a loved one suffer from this disorder, please talk to a doctor. No one should have to suffer every day from GAD. There is help out there.